was getting leg pressure, abdominal discomfort, abdominal pain, shortness of breath, and a lot of fatigue. And then I knew it was getting really bad when I developed abdominal varices. So blood vessels started showing up on the wall of my abdomen, and I knew that something was not right.
Shaun had May-Thurner syndrome, and he developed blood clots as a result of that. He had been dealing with issues of poor blood return from his legs back to his heart, compromising his ability to exercise, to snowboard, to hang out with his kids. He was feeling pain, swelling, visible varicose veins, discomfort, and overall, for an otherwise young and healthy guy with such a long and complex medical history, he was really deteriorating pretty quickly and not happy with how he was doing. He had been under the care of many other vascular surgeons and interventional radiologists who ultimately kind of told him, there's not really anything to do for this. There's nothing to be done. This won't kill you. It'll just, slowly collateralize, and you'll live with it and you'll be fine. We worked from his neck and both of his groins. We were able to get through all of his stents. We actually ended up breaking some of them up from the inside, cleaning out clot, completely restoring the blood flow such that his blood vessels and the flow now look normal. This image on the left over here is the initial injection or angiography that we did in Shaun. What we're doing is injecting the right groin over here and the left groin over here. And the important thing is the blood flow should be flowing back up towards the heart. And as I scroll through this, you can see that the blood is going into all these tortuous, dilated, varicose veins that are going everywhere but back to the heart. They're going into the body wall, they're going around the bowel, they're going into the retroperitoneum, and no blood flow is going into his IVC and straight back to his heart as it should. So he was feeling, really poorly from this because the blood could get into his legs, but it couldn't get out. After basically reconstructing all of his central veins, this is what he looks like post. And we're injecting from the same position in both groins, and we can see that blood flow is coming together into the IVC and washing straight back out into his heart in a straight line, essentially like a normal vein.
I feel absolutely incredible. It is amazing how bad I was, and now looking back on it, how great I feel today. I have no brain fog, I have no shortness of breath, I'm walking up and down stairs, I'm carrying my kids, I'm exercising, I'm hiking with elevation on the treadmill, I'm running. I wasn't able to do that before. It's absolutely amazing how great I feel.